Mimi naitwa Lineta Awuor, naishi Huruma. Niko na watoto 6 na nilianza kuvuta fegi nikiwa na 14 years.
My name is Kelvin Mwachilemu and I'm an online freelancer, and I'm also a health activist since I'm a reformer from my tobacco journey. Nikiwa mdogo, ile wakati you go visit your cousins. This particular cousin, his father was a street smoker. Whenever in the mornings tungeamka, tungeenda kwa kabati, we could get some few samples hapo, then sneak off to the woods, then go and try it out. I was around 10 or 9 years old, so nilikuwa mdogo, so ilikuwa tu ile adventure fulani ya kutaka ku-explore.
Nikianza kuvuta sigara nilikuwa class 3. I was almost 9 years. Sana nilikuwa nafuata vijana wenzangu ambao wao ndio walikuwa wanavuta sigara. Tulikuwa tunarokota sigara ndogo, tukienda shule hata saa 4 tunachelewa, tunaingia kwa choo tunavuta. So mimi sikuwa najua madhara ya sigara. Na hivyo nikazidi kuniingia. So niliendelea hivyo mpaka class 7 na nikaendelea hivyo mpaka secondary. Na mpaka nikaacha shule kwa bado naendelea kuvuta.
Sasa mimi nilianzia fegi nikiona watu wakivuta base, nikaombanga fegi nikaanza kuvuta. Nikakuwa addicted. Sasa yani lazima nivute daily. Nikakuwa sasa nikiamka nastukia nimevuta fegi. Ukikula unaivuta. Ikafika ile yenye naweza vuta nikiwa hata na packet 2.
So the addiction ilikuja around 2020 wakati the COVID kicked in. So at that time I got a job ya PlayStation. So nilikuwa naingiza dopoa in a day, and you know pesa inakuwa nyingi, you have no responsibility, so you spend it kwa vitu zote zenye hata nyingi hazikusaidii. So particularly yangu ilikuwa tobacco.
Fegi ilikuwa inani affect kifua. Nilikuwa naacha niachane na bado nilikuwa nishagonjeka kifua, nikaambiwa na daktari nipunguze fegi. Nilikuwa naacha tu niachane nayo. Nikauliza best yangu Charlie, akaniambia aliacha akatumia nini? Tumbako na ni Chavez. Nikaanza kutumia sasa hiyo Chavez. Leo velo ukiitumia unasikianga kausingizi kamekubeba. Sasa hapo penye niliingia ndio pabaya. Hiyo kitu iko na kiu mbaya. Hiyo sasa ndio mbaya. Mimi kama mwanamke msichana naweza sema hivi, hii kitu inafanya uwezi nyonyesha mtoto. Kunyesha ni shida, kukula ni shida. Mimi nilikuja nikaamua nikasema tu yenyewe hizi vitu zinafanya watoto wangu wajai kuwa na amani, wajai kuwa na furaha. Hizi vitu zinafanya uwezi oga. Nimepitia my friend, hata ni venye niliacha ni God. Ni Mungu. Hizi vitu watu wanafaa wawache. Nikaanza kunona, nikaanza kushine. Sasa nimerudi myang. Hizo vitu zinafanya unakuwa mzee uso. Nimepoteza mabeste zangu kama Rose ndio nimempoteza. Tafadhali acheni kutumia hizi vitu. Hizi vitu hakuna mali zinatupeleka.
In a day I would smoke at least 6 cigarettes. Wakati hiyo kiu inakuja sana, I would even do around 10. Then kuna hizi kubera, the ones watu wanakaga hapa ndani ya under the lips. Yeah, I even used to do them. And nicotine pouches, hizo specifically nilijua from celebrities. So at that time nilikuwa najiambia that's a safer option, but sikuwa najua naendelea kujihami. Nikakuwa concerned, juu sikuwa najua mbona nimelose weight sana. So nikaenda hosi, nikafanyiwa tests. Hapo ndio the results came back. It was positive. I had contracted TB. So that's when nilijua sasa niko affected na my tobacco addiction.
Sigara ilifanya mke wangu hataki kuwa karibu na mimi. Akaniambia harufu inatoka kwa sigara, mimi sitaki kusonga. Hapo pia ilikuja kwa akili zangu, anafikiria kwamba Mtu yule niko karibu naye kabisa hataki kunisongelea kwa sababu gani? Hata watoi, hata anaweza kuja tu karibu na mimi watoi wangu na for a few seconds akae na mimi, lakini atataka kukaa tu kando na mimi. Nilikuja kurealize kwamba sigara ilikuwa inafukuza watu karibu na mimi. Baada ya miaka mingi kuvuta sigara ikaanza kudumiza kifua. Nilikuwa nasikia kifua imeshikana. Nilikuwa nateseka sana kwa kupumua. Sasa nilikuwa navuta sigara pamoja na uchungu. Na zingine mpaka breathing inakuwa very difficult. Hiyo ilinitatiza sana. Nikiangalia watu wangu walikuwa wadogo, wananihitaji. Na sasa ni kama maisha yangu inaenda kuisha na kitu kinaenda kunimaliza ni sigara. Niko na lazima nichukue hatua. Na hatua yenyewe ndio ichukuaje? Lazima nianze pole pole.
Sasa watoto wangu wanafurahia juu kama ni lunch na wapikia breakfast. Hata mzee nilirudi hadi kwangu, nilikuwa nimeachana hadi na mzee wangu. Mtu kaa huyu sasa mimi naweza mnyonyesha mtoto wangu, anapata love, naweza muosha na mfulia. Mimi naambia God asanti kwa kunitoa kwa hizi vitu. Na hizi vitu ukitaka kuacha unaweza acha. Unaweza toa tu mahindi yako hapo, useme hii kitu kuanzia leo sitaitumia.
Zile sigara zenye sisi tumezoea, they have warnings, but ni kama hizo hazistui watu enough. We've moved on to the emerging trends, especially the vapes. There's these nicotine pouches. They're quite popular, because they are labeled eco-friendly. Then there's this one, it's mostly a contraband. Sijui inatoka kabisa, but it's the most popular side. Inaitwa Oris. So this one is cheaper because 3 go for 20 shillings, especially huku kwa informal settlements. Alafu vile iko packaged na flavors, the bright colors, to attract everyone.
Sasa watu hii wanatumia Oris. Oris ni hiyo shisha ilikuja ikaekwa sasa ikakuwa kaa fegi. Inajiita Oris. Hiyo sasa hadi mtoto wa 10 years unasikia kidai Oris anavuta.
The levels of acceptability, especially with regards to the new tobacco products, is quite worrying. The community and especially young people do not see these products as harmful because they are flavored, they look cool. So from studies that NACADA has undertaken the last couple of years, we have seen a rise in tobacco products and tobacco use in our country. From a study that we did in 2022, we were able to confirm that 1 in 12 Kenyans is currently using tobacco, which translates to around 2.3 million Kenyans. Mirroring from the same study, we were able to confirm that 1 in 30 Kenyans are addicted to tobacco products, which translates to around 1.8 million Kenyans. We did a follow-up study for students in university within our country, and from the study we were able to confirm that 1 in 17 university students is currently using vape and cigarettes. 1 in 22 is using shisha, and the worrying data with regards to shisha was female university students are using shisha more than their male counterparts, and then 1 in 24 university students are using nicotine pouches. So within our country, this is a real issue, and again, borrowing from the 2 studies, we're able to confirm the age at which young people are starting to use tobacco products is currently at 6 years, which is the lowest for all the drugs.
The government is quite concerned with the emergence of novel nicotine and other emerging tobacco products. These tobacco products include nicotine pouches, vapes, e-cigarettes, and other forms of tobacco products. Initially, they were thought to be concentrated within the urban areas, but we have established that actually these products have already found themselves in the rural setups.
The Framework Convention on Tobacco Control, that was adopted in 2004, provides a comprehensive menu of options for countries to reduce tobacco use. And so across the range of raising taxes, banning smoking in public, mandating graphic health warnings on cigarette packets, public education and awareness campaigns, they all contribute something towards bringing down the burden. But the amount of research that has been done evaluating each of these measures, even though they work together, shows that taxes are the most effective. And taxes are the most effective because they address all tobacco users and non-users at the same time. And so when you raise taxes, the cost of the product goes up, and according to the laws of supply and demand, the more expensive a product is, the less people can use it. And so it works on young people because they have got less disposable income, and therefore for those who do not have any income, it will prevent them from starting. It also works on those who are currently using, because the more expensive the product comes, they reduce their consumption.
Mi kenye naweza ambia gava, hizi taksi zenye nataka kupandisha kwa chakula, ipandishe tobacco, watu watapunguza kutumia hizo vitu. Kama unatumianga fegi pako, utatumia hata fegi 2 kwa siku ama 1. Utaenda ukipunguza hadi utaacha.
Gava increase taxes, kuna a certain age limit. Wale hawana do, unaweza kutakuwa stumbling block do kuweza kuta sigara. Kwa hivyo hiyo itatusaidia sana. Ile generation inakuja inataka kuingia kwa sigara, inaweza acha, inaweza kushindwa, inaweza kuwa poa sana.
Tobacco taxation is identified and recognized as one of the most effective tobacco control measures, and a cost-effective as well measure for reducing tobacco consumption and reducing the associated health effects, but also generating revenue that governments can use to support health programs.
When you look at the convention, the Framework Convention for Tobacco Control, it provides that taxation, the recommended retail price should be about 70% of these tobacco products. Kenya is working very hard. We now have a unified structure, taxation system. And we recently, in December 2024, we were able to scale up the excise tax, though it still remains low, between 30-35%. And I am inspired that in due course, we should be able to reach the recommended 70%. And so that these taxes, achieve the intended objective of being too expensive to the consumers. And secondly, that these monies which are accrued as revenue from the products then can go towards offsetting a lot of health burdens that have resulted from this tobacco consumption.
So as of 2025, we can refer to the Kenya Amendment tax that we had in December, which became effective by the end of December 2024. And in that new taxation law, Kenya made a major step in having uniform taxes. So taxes for both filtered and non-filtered or unfiltered cigarettes were fixed at 4,100 Kenya shillings per 1,000 cigarettes. Over time, Kenya has caught up with the newer tobacco products and introduced new taxes and also increased those taxes as of 25th December.
Kenya's tobacco tax policies have historically scored low on the Tobacconomics cigarettes tax scorecard, and it's based on specific indicators. One, the issue of affordability, and then we have Kenya's tax share being between 35 and 45, thereabout, and then we have the tax structure, whether it is the simplicity and uniformity of the tax system. And then we have the last indicator is changes in the cigarette affordability over time. So when you look at Kenya removing the inflation adjustment, it means that we are more affordable.
The current tobacco framework, if we refer to the 2024 introduction, is still new, but the simulation results show that it can be effective only if we achieve the following. Number one, we have to adjust the uniform rate upwards. Number two, we need to always ensure that our taxes are adjusted based on the inflation levels. Apart from just adjusting to inflation, we need to worry about how income growth affects affordability. So we need to have what we can call drastic changes in the taxation rates.
When it comes to systemic challenges in collecting tobacco and nicotine taxes, and particularly these new products, there's a regulatory gap. For instance, there's rapid innovation of these products. The marketing, these products are coming with new formulations, new strategies, and tax policies often tend to struggle to keep pace with this kind of innovation. There's also the issue of product definition challenges. For instance, when it comes, how do we define and classify some of these products like the nicotine pouches? Then we also have low tax rates. It's important that all nicotine products are taxed the same. The issue of flavoring, which generally appeals to the youth.
We need to make a bold decision as a country on the steps that we'll need to take to address the new tobacco products. We have our neighbors across the border, like Uganda, that has taken a bold step of banning some of these products, because Uganda, for example, has the second youngest population in Africa. And for them, because they know these new tobacco products are targeting their future, they have resolved to ban. Kenya also needs to decide whether that's a step that we would like to consider. And it's actually a recommendation by actors in this space, because the levels of penetration is still under 10% for the new tobacco products. We need to reduce access of these products. Thirdly, we also need to talk about misconceptions. Out here, people think that shisha is less harmful, vape is less harmful than smoking cigarettes. Then if these products are still allowed to operate in our market, they need to have those graphic health warnings. We need to have a conversation about flavoring and the packaging of these products. If they are as colorful as they are right now and they are flavored, of course, you know, the market, the target for the same will not be adults, it's children.
Now, these newer products were not contemplated in our laws. And therefore, when it comes to enforcing them, it became a problem. And that's why I need to report to you that we have now come up with an amendment bill to the Tobacco Control Act of 2007. And this should be going before Parliament soon. And so that we can now anchor the novel or newer nicotine products within the law, because enforcing those newer products right now is difficult because they are not in the law.
Tobacco tax being an effective measure, obviously the industry fights it a lot. And this is documented through scare tactics. These are tactics that have been documented or categorized into ways through which tobacco industry fights tobacco taxation as a measure. So the S stands for smuggling and illicit trade, because the industry pushes this narrative. The C stands for court challenges and litigation. This is where the industry then challenges or litigates against tobacco control measures, including taxation. Then the A stands for anti-poor rhetoric, and this is where the industry pushes the narrative that taxes hurt the poor. R is reduction in revenue. Then E stands for employment impact.
We applaud, number one, the recent move by the World Health Organization to push the drive for increasing these health taxes by $1 trillion within the next 10 years. But again, we also need to ensure that these taxes or the resources generated from these taxes need to be plowed back to support prevention initiatives, to support treatment and cessation efforts for people who are using tobacco, and also enforcement.
When you look at the kind of illness that tobacco use causes and the costs of those illnesses, and so we are talking about non-communicable conditions, we're talking about cancers, you're talking about other lung diseases like bronchitis, emphysema, pneumonia. And what we know from Kenya is that the cost of all of these diseases is about 44 billion Kenya shillings a year. And so when you're comparing with the amount of taxes that BAT and others are paying, from what we collect from them, for every $1 we collect from BAT, we spend $2.2 to $3 on treating these illnesses. And therefore, for us to address this imbalance of 1 to 3, then it means we need to raise the tax steeply enough that we at least collect the 3. So instead of collecting $1 and spending 3, we should be collecting $3 to spend 3, at which point then at least it becomes a net balance.
Naambia wazazi wenye wanatumianga hizi vitu mbele ya watoto, wasitumie hizi vitu mbele ya watoto juu unaweza tumia mtoto wako unatumia na yeye akuja aibe, aitumiange chini ya maji, akuwe sasa addicted.
Kama wewe ni mzazi na unavuta sigara, hufai kuvuta sigara mbele ya watoto, si hata wako, watoto wote. Make sure that environment unapotana sigara kama wewe ati imekushika sana, ni kando na watu wanaitwa watoto wale wana grow.
Within ACADA, we believe a lot in prevention. And again, borrowing from science, that for every 130 shillings that we invest in prevention, we are saving the country around 600 shillings that would have otherwise been used in the treatment, incarceration, or addressing any other harm that is associated with alcohol, tobacco, and drug use. So investment in prevention pays. We really need to increase our efforts in ensuring that children and young people do not access these substances, I dare say, up to the age of 24 years.
If the government are really serious on doing away with this thing, first they have to stop complying with these people, because sisi wenyewe tunaonaga magari ya sigara yakipeleka delivery na wanapewa escort na the same government. So how are we battling something but the same government are profiting from the thing?
We are scaling up the multi-agency teams. We want to broaden the numbers, we wanted to broaden their scope, and the Tobacco Control Act amendment will be very important, because that's one of the key areas that we have amended to give teeth. We have enhanced the penalties within the law, and so that even when we arrest offenders, when they are prosecuted, they do not go and they are given penalties which really do not have a lot of impact.
A plea to the government, particularly the Ministry of Finance, please bring back the inflation adjustment. To MPs in Parliament, please raise the taxes radically. We are asking for 50 to 70% tax increase in the next budget. And finally, to Kenyans, let's support tobacco taxes. They are good for the government, they are good for public health, they are good for you.
Nalea, lakini nikimaliza kulea ndafungua biz. Sasa mzee ananiprovide na ananiprovidea roho safi.
Sasa tuseme kwa saa hii pesa yangu marupurupu ile tunasema kidogo kidogo naweza itunza, sababu hata kama nitakuwa nikiweka mahali naweza ona matunda yake.
I was in school but I had to quit for some other reasons. But since I couldn't stay hivyo, nili launch a career in online work, specifically digital marketing. That's what I do currently, and I'm an online freelancer. Okay, so to the young people hapo nje, the onus is upon you. Your health is your wealth. There's no way you can expect to build wealth when your health is compromised. By compromising your health, I mean through addictions for specifically these tobacco products. Personally, I was a victim, but when things zilienda vibaya, that's when I made it a decision for myself that I should stop it. Trust me, if you do it gradually, you don't just wake up one day unasema I've quit. You'll end up kama mimi. So I am 3 years free of tobacco, and I can say I've improved kwa kila kitu, not only my health but kwa very many aspects.
We appreciate the partnerships that we've had over the years on this agenda of tax advocacy, and the collaborations we've had from both national partners and international, and particularly we really appreciate the collaborative effort that we have with the CSOs in the country that has supported and continue to support this work in advocating for better and stronger tobacco tax policy, tobacco tax measures in the country.